really like inviting people to consider that more of their health is in their control than they might have thought. I feel like I see new people inspired every day to realize the connections between how their habits build their lives and that they want to take ownership of that.
It's very exciting to be able to reach people, especially in rural Maine. I mean, I grew up here. Many members of my family did not, have easy access to healthcare, and so being part of a group of people that can bring more, access to healthcare and just, preventative healthcare and stuff, and really help improve the lives of people, in all the state, regardless of, financial status or, or whatnot, or backgrounds.
We break barriers. I love public health because with that public health, I go home to home and assist new men as many or any people in need to break barriers. I provide information and about available resources so they can know where to get like basic needs. So we break barriers.
It really was just, just kind of an old-fashioned sense of wanting to do good, wanting to be part of your community. Like I said, I'm a clinical psychologist. We're kind of trained to look at things from the individual perspective, but you realize there's limits to that, and you've got to be looking at the bigger picture if you're really going to have a bigger impact. And that, once I kind of discovered that, I got very excited about public health.
It's a very action-oriented kind of field to be in, where you can put things into action, you can work in community, and you can make a meaningful difference in people's lives every day.
I think it comes back to that idea of caring and of working with other people who are committed to the benefit of the group, the benefit of the public. How do we all move forward together towards a better life or a better world that we want to see? And I think that comes through in the people that I work with, in the mission of the different organizations that are represented here.
Connecting with people. I think one thing about public health is bridging science to everyone's daily lives. I think there's a lot of power behind data and connecting people with their daily living and what's important to them and how to make themselves, their family, their work, their community just better. And I think it's a really lost art of being able to connect with people.
Because you're dealing not just with the patient, but their entire ecosystem around them. Family, friends, their support community, whether that be faith or otherwise. So you really get the whole community involved with that. I think knowing that you're giving back to the community where you live, that you're using some of your expertise, like the one thing that maybe you're good at, to bring something to your community that you know that they need. And to be able to do it well and to see the positive effects.